If you are sitting with negative emotion and triggered with positive emotion by some image, it is very beneficial.
Over 160 years ago, Florence Nightingale had observed that there is more to healing the sick than the medicine. The actual key to the recovery is the healing environment. But the artworks in the hospitals is dated back to the medieval period, far ahead of Florence Nightingale. Those days, the artworks in the hospitals used to be religious. That was a norm. But coming to this age, to this 21st century, the artworks and the art programs in the hospitals have pretty been established. Hi, I'm Manisha Vedpathak and welcome to my channel. You're watching the first season of my channel, which is Art in Healthcare. Now, when I say art in healthcare, it falls into two categories. First is visual art. Visual art comprises of sculpture, mural, installations, paintings, of course. And the second category is the art program in the hospitals. The art program is the use of art in the therapies for the patient's healing process. So, what I'm going to focus on is visual art in my first segment, and we are going to focus on how the hospitals are changing and they're incorporating artworks into the hospitals to create a healing environment. So, and in every episode, we talk to a healthcare professional and get their views on whether the hospitals are really changing, whether the artworks are really doing impact on the patients. And today we have with us Dr. Saee Gokhale. So Dr. Saee Gokhale has been practicing homeopath for almost 11 years. After her BHMS, she has done completed PG diploma in homeopath clinical research, and she had been taking the awareness sessions on health in rural and as well as urban areas. She has worked as a mentor for the patients of Arogya Bharati during COVID times. A warm welcome, Dr. Saee.
Hello.
I'm really glad I got a chance to know you. A warm welcome.
Same.
Yeah. So to start with, I would like to ask you, how do you connect with art?
Actually, it is my hobby. From childhood, I am very much connected with drawings actually, and I like to draw and had so much time with my drawings actually in childhood.
Okay.
Yes. So the colors, mixing of colors, shades,
Right.
smell of color, and I am very much in that.
Mhm.
I like
Do
that.
you have any from this creative field in your family?
No.
No. Okay. But still you have that.
Yeah,
liking.
I love.
Okay.
I love playing with colors.
Oh, that's great. And as an artist, as a doctor, whenever you visit a hospital, do you ever notice artworks on the walls or installations or sculptures? Do you ever notice that?
Yes. Many a times I have noticed that.
Hmm.
So, in hospitals,
Hmm.
in the lobby area where sitting area where patient sits and wait for the doctor.
Right.
So over that way, many times I observe that artwork over there.
Okay. Okay.
So-
And do you think that those artworks really affect the patient's health, or not exactly the patient's health, but the total atmosphere, total surrounding of the hospital? Does it affect with the artworks there?
Yes. So patients and relatives
Yeah.
both are there in a very bad mood, or they are in the tension. Ki, what I am going through, they are very emotional,
Yeah.
and this frames or paintings add
Hmm.
some positivity in them.
Yeah, they are very. It's actually very stressful whenever
Yeah.
even the thought of going to the hospital is very stressful. And in old days, hospitals used to be very cold, sterile, and no artworks anywhere or no sculptures, installations. And so, what I feel is if hospitals incorporate art now, nowadays hospitals are incorporating.
Yeah.
What do you feel about that actually? Do you feel that hospitals are changing now?
Yeah, in some private hospital, I observed this. They are changing. They
Okay.
are taking this initiative of adding art in the hospital. Any kind of. They are adding paintings. Small music is there going on there in the room. So they are adding. But in some government hospitals and all, they need
Yeah,
to
they need
add
to-
this.
Yeah, they need to work on that. Actually, that awareness has to come.
Yeah.
That is what is my effort actually, to bring awareness of this artwork into the hospitals. And that is why I like to interview the healthcare professionals, so that I get more, because it's not that every hospital I visit. So, but you people are associated with many hospitals, so you do visit hospitals. Yes. So, do you use art in your clinical practice,
Yes.
like therapies or
Yeah,
something like
yeah,
that?
yeah.
Okay.
We use it with children many a times,
Okay.
because homeopathy deals with mind also. So
Yeah.
body and mind we deals with.
Okay.
In the case of childrens, they are not very clear to speak about their emotions.
Okay.
So we give them a paper and pencil, and we tell them to draw, and we can analyze that drawing.
Okay.
And so we got some hints about their mind
I
from
see.
that
I see.
paintings. Yeah.
Okay, okay. And how have you learnt about this? I mean, are these things taught during your medical studies?
No, that is my
Okay.
effort only.
Oh,
Extra effort.
so that means you are very much close to art, I must say.
Yes.
Because to analyze what a patient is drawing and to analyze from that drawing is also an art. Yeah. So, when you are visiting these hospitals, where do you normally find these artworks? Like which areas these artworks are?
So, as I said, it is in the sitting area many a times,
Okay.
in lobbies, and in cabins also.
Okay.
Doctor's cabin,
Doctor's
it is
cabins.
there. Like in gynec cabin, there are many arts like pregnant woman painting, or like
Okay.
a child painting.
Right.
They are there
Okay.
in the gynec OPDs.
Okay.
Or in the pediatric OPDs, there are cartoons on the wall.
Okay.
Like this I observed.
Okay.
And in rooms also, or wards also. So it adds freshness in the room, some positivity in the room.
So this means that the artworks are specific to the specific departments.
Yeah.
Like as you said, for pediatric there are cartoons.
Yeah.
So that means the what kind of patient comes to that department, the art consultant has to look into that,
Yes,
right?
yes.
Before selecting the artwork.
Yes.
So that's what I was going to ask in my next question, that what type of themes do you normally find in the hospitals? Like a painting's theme. Normally what theme is there, whether it is abstract, whether it is nature, flowers, cityscape, or water, seascape, something like that.
So nature drawing and flowers, I think they are
most common.
Yeah, they are most common, as they are adding liveliness in the room. So nature drawing is there. It is observed by me.
Okay.
Many a times.
Okay. And another thing which I would like to ask is, as you say that the artworks does positive effect on the patients, at the same time, does it also affect the staff and even the caregivers?
Yes.
Does it affect them?
Yeah. Staff, or they are very, doctors are doing a special work, and the staff is cleaning or bandaging the patient. So they are doing very much hard work in the hospital,
Yeah.
and it is very stressful to them. So these paintings are effect. It is like calmness. They are adding calmness in the staff, in their mind actually.
Yeah, and I think it may also be sparking, or maybe I can say sparking memory, or I can even say that conversation. An artwork can be a conversation starter also, right, between the patient and the staff or the caregivers, something like that.
Yes, actually. Um,
Because looking at nature, sometimes you remember some,
memories are triggered.
Yeah, memories are triggered with that artwork by
Yes.
looking at the nature, or maybe whatever is there into that. What I can say is that the images in the painting, I think, there's a direct association with the brain's response.
Yes.
To pain or stress or anxiety.
Yes. Many images are there in your brain, so it creates a memory. And when you see something relating to that memory, it triggers your emotion.
Exactly.
So if it is related, you any kind of emotion, you feel happiness, you can feel pain. If you see any bad picture on the wall, or a horrible picture on the wall, it can trigger your previous incidents and emotion. So
if at all it triggers a positive memory, I think the patient must be. I mean, the study shows actually. What I'm not saying it from my point of view, but the study shows that these images trigger the memory, and they distract the patient from their pain. Right?
Yes.
That is what is happening.
So in sitting area, this is very important.
Yeah.
If
in waiting area. Yeah.
So if you are sitting with negative emotion and triggered with positive emotion by some image, it is very beneficial.
Yeah, even the areas where you are waiting for doing some tests, X-rays, surgeries, or something like that. Even that area, because patients are so much anxious during that time. I actually wonder that when MRI is being done, or when I think CT scan is done, during that time patient has to lie down, right? So I always wonder that where can artwork be placed in that area?
It is food for thought. I think it is maybe not on the ceiling, but just below.
We can actually put it on the ceiling also. Yeah.
Okay.
It can be put on the ceiling.
Okay. Yeah,
that is what I was saying, because people are anxious during that time also. So much of anxiety is there during that time.
Yes.
And if people are lying down and looking at the artwork over there, they'll be distracted from that.
Yes. This is a nice idea. Actually.
Yeah. So so what color palette do you think that the art consultant should take into consideration during the selection of art?
It should be like green, blue side, maybe cool colors we say, because they bring calmness, they bring freshness, as it is related with nature. So greenery always brings freshness in us. Right. So the green color brings freshness, and red, black, hot, warm colors, they are impacting on mind like anger. The red is for anger, we consider. And also red is the color of blood. Yeah. So maybe that also will horrible color that is. Yeah, anxiety a lot. Yeah. So avoid those colors. Red, brown. Brown is towards what we say, negativity kiva. Not negativity, but dullness. Brown is towards thoda sa dullness. So we avoid brown, red colors. So adding freshness is the key in the hospitals. Right.
Even the this color palette is used into the therapies, I think, color therapy. Yeah. And next thing which I would like to ask is, what size of the artwork should be taken into consideration? Normally, what size do you see in the hospital? Are they big size or very small size? And which size is impactful according to you?
Medium, not so
Medium.
big and not so small, because the people need to see, actually see to them. And very big sizes impacting so much on the patient, maybe.
Won't that big size distract people if they're lost into that painting? It will distract them from anxiety or from the stress.
But if that is going to stress more, then they can create more stress also, no?
Yeah, then it will depend on what theme the artwork is.
Yes.
Yeah.
What is there in the frame and what theme they have taken. So if there are so much geometrical shapes with so much different colors, it can form so burden like feeling, maybe.
Okay.
So we have to keep it subtle.
Right. And given a chance, will you advocate the artworks in the hospitals?
Yes, of course.
Like
I would like
creating aware, just like how I am interviewing you to create this awareness.
Yes.
Will you advocate
Yes.
hospitals, whomever you are in contact with, and
Yes,
try to
definitely.
explain them the benefits of having artworks in the hospital?
Definitely.
Yeah.
Even I that line is going on in my mind. So I have some places.
Right.
We have to go over there and we'll speak to them.
Yeah. That's great. Because in Indian hospitals, I mean the big hospitals like multi-speciality hospitals, what we call it nowadays. So I see artworks in those hospitals, but like some old hospitals are still, like government hospitals also, they are still lacking these things.
No drawings, no freshness. And if you go over there, you feel very depressed.
Very dull.
They
Very
need
dull.
to add.
Yeah.
Yes. Even I have a group of mentally retarded patients.
Okay.
And the caretaker who is with them, she is taking a workshop of artwork for them.
Oh,
so
I
it
see.
is beneficial for this kind of patients also.
Right. So is it some organization or
Yes,
it
it
is?
is
It
organized.
is. Okay. Okay. And do you think art can impact people?
Yes, definitely.
Uh-huh.
As I said, very much impactful it is. If you see any nature drawing, any drawing with raindrops are there, you feel fresh, you feel happy.
Right.
Or you see any happy face in the painting, or unconsciously you uh, laugh, smile after seeing that painting. But if you see any horrible painting, it creates negative impact on you.
And if at all you want to put a painting in your clinic, what theme would you like to select?
I like to select greens. And
natures.
Yes.
Okay, that's great. So coming to my last question, I would like to ask you that what do you think about my effort of creating this awareness of artworks in the hospital?
You are taking great effort. You are helping doctors.
Thank you.
For giving patients relief and making them calm and positive. So thank you so much. This is very useful, and we want this awareness in the world.
Thank you so much, doctor. It was lovely talking to you. And I wish you get more time to spend with art. As it is, you're spending with your patients, but also making art, creating art. I
like
wish you get more time in that, and wish you all the best in your clinical practice also. And it was great having you in my channel. Thank you so
Thank you
much.
so much.
So, guys, we had such an insightful talk with Dr. Saee, and I hope you have liked the video. If you have liked the video, do hit the like icon. Do not forget to hit the bell icon to get the updates of my new videos. Thank you so much.